That's right, Terry. The health department says they will actually be interviewing that third patient tomorrow morning. Now, what we do know is that they are between 40 and 50 years old, traveled out of the country, but they're also investigating travel to Fort Worth on March 12th. Now, like you mentioned, they also clarified what low, medium, and high risk categories look like. Now, some big things to point out on this graphic is high risk is something like living in the same house as someone. Now, with COVID-19, low risk would be being in a classroom or a hospital waiting room with someone who has the virus.
Our caregivers have stepped up, both at UMC and at Covenant. They have not bucked one bit about their professional responsibility to care for the sick.
UMC and Covenant Health are teaming up and making changes to tackle the coronavirus.
We also have moved forward with canceling elective procedures at this time. We will reassess that in 2 weeks. The rationale behind that is that those patients use resources that we may need for a surge of illness.
They're also limiting one guest per patient, along with opening a drive-through screening that allows patients to be tested for the virus.
We have is a few lanes set up with some nurses that will ask them preliminary questions, decide whether somebody meets the criteria to consider testing. They move forward. If they continue to meet criteria questions, we do a rapid strep and a rapid flu.
Barker says if a patient has the flu or strep, it is highly unlikely they'll have COVID-19.
If those are negative and all the other questions fit, then we're sending a COVID-19 screen. We're sending those to Austin, and we're going to get the answers back in about 24 to 48 hours.
Looking ahead to city operations, beginning Monday, City Hall will be closed to the public except for the Viral Statistics Office.
They'll be able to transact at that one counterpoint in person. But as I'm going to say 2 more times, you can also do that by mail. You can also do that online.
The Lubbock Power and Light Lobby will continue to serve customers.
The purpose of maintaining those customer service points there is really to help people with getting new utilities started or to do reconnects. Remember, we have suspended disconnects, so we do expect that traffic to drop.
Now, adding to that list, water, customer service, the airport, and city buses will remain open. Now, in addition, all 4 libraries will offer curbside service.